Good morning, judges. I am Dr. Rajneel Bhattacharjee, Registrar, Silchar Medical College and Hospital. It's not proceeding. Next page. Thank you. Okay. Blunt trauma forms a major part of ocular trauma. Blunt trauma forms a major part of ocular trauma. It can occur either due to direct blow to the eye by fist, ball, or blunt instruments like sticks and stones. It can also occur following road traffic accidents or in industries. Many ocular injuries can be prevented by using appropriate protective gear like helmets or goggles and seeking necessary medical care. The extent of ocular damage depends on the severity of trauma and can range from obvious ocular damage to obscure long-term effects. The aim of the study was to assess the different effects on eye and vision due to blunt trauma to the eye. It was a prospective hospital-based study. 100 patients with blunt trauma injuries of all ages and sex presenting to ophthalmology, OPD or emergency department over a duration of 6 months were included. The inclusion criteria were any blunt trauma injury patients of any age or sex, and the exclusions were like trauma with sharp objects like knife, pen, needles, or chemical injuries, or if any patient has pre-existing ocular diseases affecting visual function. A detailed history, including demographic details and injury factors, were taken. Initial visual acuity on Snellen's chart, external examination, slit lamp examination, tonometry, dilated fundoscopy, gonioscopy was done. Further investigations like X-ray orbit, CT scan, USGB scan were done in relevant cases. Informed consent were taken from all the patients. If we see age-wise distribution of patients, the most common age affected was 21 to 30 years, where around 28% of injuries occurred. If we go for the sex-wise distribution, we can see there is male preponderance with 69%, and if we divide the cases depending on the source of injury, so the most common cause of injury was RTA, that is in 63% of cases, followed by the physical assault, which constitute the majority of the blunt trauma cases. Now, if we divide on the visual deficit at the time of presentation, so we can see that only 55% of patients had no visual deficit, and in 23% of patients there was only uniocular deficit. Now, distribution of cases based on orbital injury, the most common presentation was with ecchymosis in around 71% of cases, and followed by 58% cases which had lid enema. With depending on the anterior segment injury, the most common 42% had only conjunctival congestion and 27% had subconjunctival hemorrhage, with few cases having abrasion or hyphema, only 2%, 4%. And on clinical finding on the posterior segment, only 2% of patients had retinal detachment, 1%, only one patient had Berlin's edema, and 2 patients had vitreous hemorrhage. Similar findings were done in other studies like Jain BS, Soni SR, RN Kushwaha, Rashmi Rastogi, and Doti GH. So, to conclude, from this study and the other studies, we can infer that young adults, that is the age group where it is more prone to blunt trauma to the eye, and the majority of injury are associated with lid and anterior segment, with majority having no visual deficit, but the most common cause of blunt trauma injury was the road traffic accident, followed by physical assault. Thank you.
So, did you perform some investigative procedures like OCT for
yes,
all this patient? For
all the
patients?
required investigations were done. For management was different. This was just on the presentation and to find out the cause, where we can see the more common of blunt trauma, or if we can try to reduce.
According to your study, all 7 rings are not affected. Almost in 1 or 2 cases only,
yes,
one
sir.
ring is affected.
Yes.
Remaining all cases, nothing has happened.
Nothing happened.
Great.
So blunt trauma is very common, but
First of all,
injuries
blunt
were
trauma
very.
is not according to current traumatology. There is no word like blunt trauma. It is a closed globe contusion. Right?
Yes. Yes.
Thank you.